In this video by DeckPlate, we will understand the VA disability ratings for stomach and duodenal conditions, not including GERD or esophageal disorders, stomach, stenosis of, stomach injury of, residuals. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Stomach stenosis, diagnostic code 7309. Stomach stenosis refers to the narrowing of the stomach, which can lead to problems like obstruction or delayed gastric emptying. When rating stomach stenosis, the VA evaluates the condition as chronic complications of upper gastrointestinal surgery, diagnostic code 7303, or peptic ulcer disease, diagnostic code 7304. Depending on the predominant disability, stomach injury residuals, diagnostic code 7310. Residuals of stomach injuries can result from trauma, surgery, or other conditions affecting the stomach. Preoperative, rate as adhesions of the peritoneum, diagnostic code 7301. No actual adhesions are necessary to rate under this diagnostic code. Postoperative, rate as chronic complications of upper gastrointestinal surgery, diagnostic code 7303. Chronic complications of upper gastrointestinal surgery, diagnostic code 7303. The VA provides specific ratings based on the severity of complications from upper gastrointestinal surgery, 80% rating. Continuous need for total parenteral nutrition (TPN) or tube feeding for more than 30 consecutive days within the last 6 months. 50% rating. Symptoms include any one of the following: daily vomiting despite oral dietary modifications or medication, 6 or more watery bowel movements per day, or explosive bowel movements that are difficult to predict or control. Postprandial lightheadedness, syncope, with sweating, requiring medications for complications such as dumping syndrome or delayed gastric emptying. 30% rating. Presence of 2 or more of the following symptoms: vomiting 2 or more times per week, or persistent vomiting despite medical treatment. Discomfort or pain within an hour of eating, requiring ongoing dietary modifications. 3 to 5 watery bowel movements per day every day. 10% rating. Symptoms such as nausea or vomiting, managed by ongoing medical treatment. 0% rating. Postoperative status without symptoms, asymptomatic. Adhesions of the peritoneum, diagnostic code 7301. Adhesions of the peritoneum are scar tissue that forms after surgery, trauma, disease, or infection. These adhesions can cause bowel obstruction, pain, and other gastrointestinal issues. 80% rating. Persistent partial bowel obstruction that is inoperable or requires total parenteral nutrition, TPN. 50% rating. Symptomatic peritoneal adhesions with recurrent obstruction, requiring hospitalization at least once a year, medically directed dietary modifications, and 1 or more of the following symptoms: abdominal pain, nausea, vomiting, colic, constipation, or diarrhea. 30% rating. Symptomatic adhesions requiring dietary modifications, and 1 or more of the following symptoms without recurrent obstruction: abdominal pain, nausea, vomiting, colic, constipation, or diarrhea. 10% rating. Symptomatic adhesions with 1 or more symptoms, without dietary modification requirements or hospitalization. 0% rating. History of adhesions, currently asymptomatic. If you are dealing with these conditions, it's essential to consult with your healthcare provider and VA representative to ensure that your condition is accurately assessed for benefits. Thank you for watching this video. Please don't forget to subscribe and like our videos.